Hello, and welcome to Nursing Research Tips, a show dedicated to sharing best practices, tips, and other resources within the areas of nursing research and evidence based practice. I'm your host, Jenny Barrow, Associate Professor of Undergraduate Nursing, who specializes in teaching students real world content to help transform their future nursing practice. I enjoy taking the boring world of research and EBP and making it come alive for my students. And that's what I intend to do with this podcast. On today's episode, I have some special guests from my university's undergraduate nursing research and evidence based practice course. Justin Johnson, Jolie Leblanc, Emily McBride, Danielle Smith, and Jashaylin Thomas are joining us to discuss their evidence based practice project. Before they get started with their discussions, I want to let our listeners know that I have shared a copy of these students' evidence based practice poster to accompany this podcast episode. You can find this resource in the show notes for whatever podcast platform you are currently listening to. Now, without further delay, let's turn the show over to Danielle to get us started.
Hello, listeners. I'm Danielle Smith, and on behalf of my amazing team, I'd like to welcome you to our podcast. Today, we'll be talking about something pretty exciting. It has to deal with research on AI detection of sepsis in hospitals. If you ask me, it kind of sounds a little futuristic, but it's happening right now. Our team consists of Justin Johnson, Jolie Leblanc, Jashaylin Thomas, and Emily McBride. We're all undergraduate nursing students here at McNeese State University, coming to you live from Lake Charles, Louisiana, where the crawfish is hot, but the research is even hotter. So grab your coffee, or a nice little daiquiri if you want to, and join us as we dive into how artificial intelligence is stepping in to save lives. So let's get started. Sit back and enjoy.
Thank you for introducing your team and your overall project topic to our listeners, Danielle. It seems that you are very passionate about this topic, which makes me want to learn more about your topic as well. I know artificial intelligence has been a big buzzword on social media, but also in academia. So I'm sure we have some listeners who will be just as excited to learn more about your group's project as I am. So, Danielle, can you tell our listeners a bit more about why you and your group members feel this topic is significant for nursing?
So, our group chose this topic because we've seen how artificial intelligence has been popping up everywhere, from Siri to self-driving cars. But what really caught our attention was how AI is starting to make waves in the healthcare field. The technology has gotten extremely sophisticated, and it's being used in ways that could change how we approach patient care. One of the most important areas where AI is being introduced is in early detection of sepsis. For those who may not know, sepsis is a life-threatening condition that happens when the body's immune system basically goes haywire after an infection. This can be really tricky because the symptoms can be subtle and easily mistaken for something else, which is why it's so difficult to catch early. The problem is that delayed diagnosis of sepsis can lead to higher mortality rates. Patients simply do not get the intervention they need in time. Now, usually EHRs have been used to look for potential cases of sepsis. However, these alerts don't always go off soon enough. And when they do, they can be inaccurate, meaning patients don't get the help they need fast enough. This isn't just a healthcare issue, though. It creates emotional, financial, and even ethical stress for families, patients, and healthcare providers. So the question is, can AI do better? AI-driven predictive tools could analyze a ton of patient data in real time, identifying sepsis risk earlier and more accurately than the old EHR systems. And that's exactly what we're looking to explore in this study. Can AI make a difference in early detection and help improve patient outcomes? Our group think it's a pretty important deal for nursing and healthcare overall. If all if AI can do what we hope it can, it could be a game changer for saving lives and improving care globally. This can potentially cut down on mistakes and reduce mortality rates. It could bring a much needed shift in how healthcare providers respond to this critical condition. So, as we dig into this, we're looking at how AI stacks up against traditional methods in terms of alert, accuracy, response times, and ultimately patient outcomes. And if the results are as promising as we hope, we could see AI tools becoming a routine part of healthcare systems everywhere.
Thanks for defining what sepsis is and explaining why a timely diagnosis of sepsis is so important for our listeners, Danielle. Big data based machine learning algorithms within electronic health records, or EHRs, are indeed at the cutting edge of patient care technologies. You provided our listeners with a solid background for why this overall topic is significant or important for the nursing profession. So, next, Jolie, can you tell us what your group did next as the next step within this overall evidence based practice project?
Now that we've established the significance of this evidence-based practice topic to the nursing profession, I want to share our group's evidence-based practice question with our listeners. We crafted our evidence-based practice question in the PICO format to include population, intervention, comparison, and outcome. The question that guided our literature search on our topic was, in hospitalized adult patients in acute care settings, does the implementation of an artificial intelligence based predictive analytics tool within the electronic health record compared to standard electronic health record alerts improve early detection of sepsis and reduce sepsis related mortality?
Thank you for sharing your group's PICO question with our listeners, Jolie. This question served to focus your group's investigations into the published literature. Can you tell us more about how you use this PICO question to help you find published studies about your group's selected topic?
We used our group's PICO question to create keywords to search the following university library databases: Academic Search Complete, Medline, and National Institutions of Health. Some of the keywords that we used for our searches included artificial intelligence for early sepsis detection, artificial intelligence in healthcare, artificial intelligence for sepsis prevention, electronic health record nursing, and artificial intelligence in nursing. The specific search limiters we set on our searches included articles written within the last 5 years with access codes to full text available. Those that were quantitative studies, which basically just means that they are based on numerical statistics that are measurable instead of subjective experiences like a qualitative study would. And finally, we limited it to articles that are peer-reviewed. When conducting this search, there were plenty of studies and resources available regarding artificial intelligence and or sepsis. But with that being said, it was difficult to determine how best to refine our search in order to limit the number of sources we needed to analyze. This is especially considering that a large portion of the original search results did not pertain to the specific research questions we formed. When trying to correct this, we used simpler and more straightforward terms instead of the whole sentences to search. Something we had not considered thoroughly before we started to search was specifically looking for original research articles. This means that they contain primary data. Instead, our findings were largely based on systemic reviews, and further research was required. It may be helpful for others who are struggling with a literature search to use a variety of databases in order to get a comprehensive data set. Different databases can provide content centered around a certain specialization in a field or discipline. This could be including things like clinical medicine, physiotherapy, and biomedical literature. Doing this can help to increase one's chances of finding all of the relevant studies and reduce the chance of coming up with skewed results.
I appreciate that you shared some helpful insights into your group's literature search process, Jolie. Thanks for sharing how your group used a bit of trial and error to navigate through difficulties in your literature search journey. Your topic is based heavily in the technology sector, which means that the research studies you are looking for might have been indexed in different professional databases than other more common evidence based project topics. That's why your tip of selecting the right databases for the project specific focus is so important. Now, after your group reviewed these retrieved peer reviewed studies, what key evidence did you find pertaining to your group's specific PICO question?
After conducting our literature search using the methods previously described, we sorted through study articles to find high-quality studies that specifically addressed our evidence-based practice question. Each group member was responsible for critically appraising a single study article, and we synthesized the studies into a guiding group synthesis table to get a bigger picture and a better understanding of the state of the science surrounding our topic. After reviewing our study articles and discussing them as a group, we identified key evidence that we would like to share. Most of our sources used a retrospective cohort design. For those in the audience that aren't sure what that means, the studies utilize data from previous patients before their diagnosis of sepsis to see if AI could show promise in early detection. This approach allows researchers to evaluate AI's predictive capabilities by comparing its alerts to actual patient outcomes. These analytic programs monitored various data points, which differed from source to source, but overall, they included components such as physicians' progress notes, nurses' notes, inflammatory biomarkers, lab work, and vital signs. Collectively, these sources concluded that AI programs are proven to allow for detection of sepsis by monitoring individualized patient information. Beyond simply detecting sepsis, AI models also enable the ability to flag patients that are more susceptible to and put at increased risk for developing it, which in turn would suggest a need for closer monitoring by healthcare staff. We found that certain populations, such as the elderly and individuals with comorbid conditions like diabetes, are at highest risk. Understanding this, coupled with high-risk alerts that an AI analytic tool would provide, healthcare professionals are allowed to act in a preventative manner. Compared to a standard electronic health record alert, AI models were found to detect sepsis sooner, with better accuracy, and with decreased incidence of patient status deterioration within multiple healthcare settings and systems. When caring for a patient with sepsis, time is gold. Considering early intervention, such as antibiotics and IV fluids, can quite literally save lives. Mortality rates also improve in settings where artificial intelligence is utilized for sepsis detection, as it enables the recognition of subtle patterns that yet to present in an obvious clinical manifestation.
Excellent discussion of the studies that your group reviewed, Justin. I appreciate that you explained what retrospective study designs were and how they fit well within your group's selected topic area. Just as a recap, retrospective case control studies can be helpful in specific situations in which researchers want to start with a group of hospitalized adult patients who have medically confirmed sepsis diagnoses. These are the cases of interest. We're interested in these people, this group that already has sepsis. The researchers then looked backwards, hence the use of the term retrospective, to see how that facility's AI sepsis indicators worked or maybe didn't work. What common trends were noted in these adults with sepsis that were officially diagnosed? What were their trends that were shared? Was it shared biomarker data or laboratory data? Were there trends that were common with vital signs and changes in those? These types of studies help provide the data needed to build the machine learning models that provide the basis for these types of AI programs. Researchers, using retrospective case control designs, can see if the analytics were truly predictive. If the AI analytics built into existing EHRs accurately predicted correct cases of sepsis with minimum false positives and false negatives, we could ascertain that these tools are clinically valid depending on the rigor of the research that we're looking at. So, now with that explanation behind us, Emily, can you tell our listeners about some additional key implications that nurses across all clinical specialties who may use these tools should consider based on the reviewed literature from your group?
So, based on the information our group reviewed, we identified some very important implications for nursing practice. Nurses play a very critical role in leveraging the AI-driven risk assessments. These tools analyze patient demographics, lab results, and clinical status to detect early warning signs of sepsis. However, AI is not a standalone diagnostic tool. It serves as a decision support tool. This means nurses must use their clinical expertise to validate AI-generated alerts and to take appropriate action. When an AI system flags a potential sepsis case, nurses are responsible for escalating the concerns to physicians so that they can ensure timely intervention with antibiotics and other necessary treatments. Quick decision making is very crucial for nurses. These AI sepsis alerts can be used in many areas and specialties within hospitals. The intensive care unit, emergency room, and even just basic med-surg floors would benefit greatly from the tools that my group and I have researched.
Thanks, Emily. You provided our listeners with some helpful takeaways for how nurses can leverage these tech-based tools while also reinforcing the importance of the nurse's own clinical judgment and experiences. AI tools, while helpful, do not replace the nurse's need to perform assessments properly, then to document those assessment findings properly, while always remaining vigilant to changes in patients' presentation. The assessment documentation piece becomes even more important when you consider that what these nurses are entering into the electronic health record is one of the key pieces of information that feeds into these predictive algorithms. The algorithms are only as accurate as the information entered into the system. And sometimes human error is at play if we click the wrong button or we enter the incorrect data on the incorrect patient within the electronic health record. So, Emily, did your group find that there are any gaps in the present literature that might require more studies in the future?
While AI has shown promise in acute care settings, there are still gaps in the research, particularly in long-term care settings. Sepsis often develops more gradually in these environments, making early detection even more crucial. Future studies should investigate how AI models perform when applied to long-term care, like nursing homes, rehabilitation centers, and home health care settings. Factors such as slower disease progression, different patient demographics, and varying levels of clinical oversight may impact AI's accuracy and effectiveness in these environments. Additionally, research should explore whether AI can be integrated with remote monitoring tools, helping nurses and caregivers identify sepsis risks earlier in patients who may not be under constant medical supervision. By expanding research beyond hospital-based settings, we can develop more inclusive and adaptable AI tools that improve early sepsis detection across all levels of care.
Okay, so your group has given us a lot of excellent information about the current state of the science surrounding your selected clinical practice topic. After all of these research studies that your group reviewed, including considerations for study weaknesses and continued gaps in the present literature, as you just mentioned, what was your group's overall literature based answer to the original PICO question you shared with us earlier?
I'd like to conclude that after all the research studies that our group has reviewed, we were able to determine an evidence-based answer to our evidence-based practice question on artificial intelligence and its role in detecting sepsis early in hospitalization for adult patients or acute adult patients. Before you start understanding the research, you have to understand the importance of the condition, which is sepsis at hand. Sepsis is a life-threatening condition that can cause serious issues to the body, usually following or an extreme response to an infection. So you could see how it's incredibly important that as nurses, we understand that it's a critical environment and it's really hard to survive. With that being said, it's important that we have good assessment skills. But despite the medical advancements and diagnosing of sepsis in early stages, it remains a challenge for healthcare professionals. This is where AI can come in and play a role in implementing AI in acute care settings, can change those results and make them better, and therefore decreasing mortality rates. So, how would AI do this exactly? Well, AI is able to generate real-time alerts and give clinicians crucial heads up whenever a patient is at risk for any sepsis signs by basically analyzing vast amounts of patient data, whether it's physiological, psychological, or demographic. So, since AI allows for such a proactive approach, it then allows time for interventions by the healthcare professionals. And through our research, we learned that AI driven models not only enhance early detection, but also contribute to improve intermediate or immediate patient outcomes. With that being said, after reviewing extensive quantitative research, our team strongly agrees that AI has the potential to revolutionize sepsis detection in clinical settings. This project has brought to light that it is very important that as nurses, or even nursing students, that we stay up to date on research and how to care for patients. Nursing is a job that is big on performing tasks, but it's also about making informed clinical decisions because that can then lead to best possible patient care. And considering that healthcare is constantly evolving, nurses must be able to adapt to new treatments, new technologies, and things that are considered best practice.
Thanks for wrapping up your group's discussion, Jashaylin. I'm proud of each of you for integrating the content that we've discussed in our undergraduate nursing research and evidence-based practice course into this real-world literature search process. You and your group members will be entering the RN workforce during a time of rapid technological advancement in the healthcare setting. One pearl of wisdom that I'd like to share with your group and with our listeners is to always remember that as nurses, we are not providing care for technology. We're caring for humans with unique holistic healthcare needs. Technology can help us do our jobs more effectively and efficiently, but we must always listen to and respect the unique needs of our patients while we interface with that technology that's needed to perform our roles effectively. At this point, I would also like to thank our listeners for going on this journey with us. Technology in healthcare is not going away. As healthcare consumers, your access to healthcare technology with integrated healthcare records and one click away on a smartphone app is just the start. Your healthcare providers will continue to adapt as the technology adapts and expands. However, as I mentioned before, our jobs aren't all about the technology. It's all about you. and doing the best job we possibly can as nurses to provide personalized, high-quality care during your times of need. Thanks again for joining us today.